care. Hey, everybody. Bob Lucero from All Things Leland. Thanks for joining us. You've heard me say this before. Brunswick County, sixth fastest growing county in the United States. By median age of its residents, the oldest county in North Carolina, and we live in the seventh fastest growing region in the country. And with that comes the demand for services, including healthcare. And as a follow-on, we're pleased to have today Lori Whalen, who is the president of Novant Health Coastal Region, to talk about Novant Health's application to bring 225 new beds to the Wilmington region. So, Lori, thanks for joining us.
Thanks for having me, Robert. We look forward to it.
Thank you very much. And let's just get right into it. I mean, I know
Yeah.
that Novant Health has submitted an application for 225 beds to help consolidate some of its cardiac care services and other programs. Perhaps you could talk a little bit about that.
Yeah, of course. So I'll talk a little bit about, our CON application, I would say, is really part of a bigger, broader project. The CON is just a portion of it for the inpatient beds. And so we've been sharing with the community over the past year that we had the largest project ever funded by Novant Health, and funded right here in the coastal region for over $1 billion, 1.26 to be exact. Not that I'm counting.
Yes.
And so part of that plan was a multitude of things. One is our Heart and Vascular Tower, Heart and Vascular Institute, which is going to go right on our 17th Street campus, where our current rehabilitation hospital is.
Okay.
That rehabilitation hospital is going to be relocated over to our orthopedic campus. It's going to be a freestanding building. It's almost going to double in size. That's already been approved by the state. Shovels go into the ground this month in
Okay.
July to start that process. State has already actually cleared us to build the tower on the campus, so we've already gotten that clearance. And then as part of that, we will also be renovating our first floor within the hospital at 17th Street, which connects to the Heart and Vascular Institute. And it's really to provide the growth of the infrastructure to be able to
Mhm.
support the expanded services. Our hospital was built in 1967. A lot of the infrastructure and support services were built for a hospital in
Yes.
1967. So we can't expand our surgery area, our radiology area, even our food services. So this is going to allow us to expand that to meet the growth over the next 10 to 20 years. And then if you look at our campus, on 17th
Yes.
Street and how the services are, if you've ever been there, we're sort of centered and anchored in institutes. Our clinical service lines have designated areas for care. Zimmer Cancer Center, our Dolores P. Jordan Neuroscience Center, our Betty H. Cameron Women's and Children's Center. We don't have that for Heart and Vascular, and Heart and Vascular is one of the most demanded services we have. We see about 8 to 10 to 12,000 new heart patients per year. It's
Okay.
growing. It's one of our fastest growing service lines, and we have top-notch care ranked by the heart centers as one of the top 100 heart hospitals in the country. And so we don't have the facilities that match the care that we're providing. And so that was why it was determined to invest in this new Heart and Vascular Institute.
Okay. And the 225 beds will support that effort?
Correct. So what we're doing is the 225 beds will support that effort, but what that will also do will allow us to expand inpatient bed capacity for also patients receiving other care.
Mhm.
So whether that's medical, surgical patients. So in our application and in our projections to the state, you will see inpatient capacity for all of those services.
That's great. And cardiovascular services has grown significantly based upon on your comments. Maybe you could just explain a little bit more about that.
Yeah, I mean, it is obviously we live in an area and a region of the country, often called, the stroke belt, where we do see a lot of heart disease
Okay.
locally. We have also significantly expanded our development of our service lines, particularly those that are high acuity or the sickest of the sick
Hmm.
patients. So these are patients who need what's called mechanical support of their heart.
Okay.
We open heart surgery. We've hired one of the top notch in the country heart failure doctors to
Okay.
support that program. And so continued investment in recruiting of subspecialists.
Okay.
And with that comes the need for the facilities to support that. We're also we expect to hire 80 doctors over the
Okay.
between now and 2031 to
Wow.
support these services. We're also building an additional out part of that plan that I talked about earlier. That's part of the inpatient beds, but also we're building another outpatient heart building on
Okay.
our campus that's across the street for outpatient services. So we're building another 80 to 100,000 square foot to be able to support the recruitment of those physicians so they have a place to practice and see their patients on the outpatient side.
So there has been a lot that's been approved. This application is obvious is for the 225 beds. Um, North Carolina is not unique, having come from Virginia, which is a certificate of need state. Perhaps you could talk, generically about the certificate of need process, how people can weigh in. I know public
Yeah.
comment period just opened and closes at the end of the month.
That's right. Yeah. So the applications for this cycle for these beds in particular were due on June 15th. So we've submitted our application and we know, the others have as well. The public comment period and those applications are publicly available now through the DHSR
Mhm.
Health and Human Services for North Carolina website. You can access those. Public can comment up until the end of the month. So it'll be open until July 31st where people can comment on applications. From there, there will be a public hearing in August
Okay.
where applicants will share some highlights about their application, and then well as members of the public can come and speak on
Okay.
behalf of any organization. And then from there, the state will go into their review period. And so we anticipate that's going to take probably close to the end of the year, likely end of November would be that timeline for the state to review. They can request an extension. Sometimes that happens if they needed more information or needed more time, depending on the number of applicants. They can request that, which would put us into mid 2027, but we won't know that probably until the end of the year.
And just for our viewers' information, I mean, what does the state look at, Lori, when they are considering an application?
Yeah, they typically look at four main areas, right? Obviously, they will review the full application in all of its entirety and all of its appendices. They're
Yes.
quite long applications, which I'm sure you've noticed. But a couple of things we'll talk about. First one, which I'm sure we know you're talking to other applicants as well, is competition, right? Does
Yeah.
it provide choice and other services, which we're supportive of? The other thing it's going to look at is one of the most important is scope of services. Are you providing additional services and needed services to the citizens of New Hanover County, or are you duplicating services? So that's part of the certificate of need process, is
Mhm.
to ensure that there's not duplication of healthcare services, which we know can sometimes tend to increase the cost of care in general. And
Okay.
are you providing new services that aren't being provided? They'll also look at location. So they'll also say, where are these services
Mhm.
being provided? Is it in a new area where healthcare isn't, where patients and citizens can access it more readily? Or is it nearby other healthcare services? So again, more of that duplication. And then the last, what probably one of the most important, is they'll look at utilization. So
Mhm.
they will make sure that you've got sufficient evidence, sufficient support, physicians, staff support, and plans to be able to utilize a sufficient number of those assets by year three is what they really look at. And that to me is the most critical one of all of this,
Mhm.
scope of services, but utilization. New Hanover Regional Medical Center is the hospital that generated the needs for these beds.
Sure.
So we're the ones saying we need these beds,
Mhm.
right? And so that's why, to me, it's key. We're at a high occupancy capacity. And in the region, there are some hospitals that are underutilized,
Yeah.
and we just can't have that in New Hanover County. So to me, that's one of the most critical elements to be looked at. And that's what the state pays the most attention to.
Yeah, when I was talking to Dr. Gutabi, who's the economist at
Yeah, he's great.
UNCW, and one of the fastest growing employment categories in our region is healthcare. But I mean, and you just touched upon it, 80 new docs to help serve the new facilities, but there's also nurses, support staff, pharmacists, food service. So it's a significant investment beyond capital.
Wholeheartedly. I mean, we just as an example, we today we're opening our Scotts Hill facility up in the Porter's Neck and Scotts Hill
Okay.
location. This hospital is an 80-bed hospital, 66 licensed bed with 14 observation.
Okay.
Just for perspective, we've hired 700 team members, so
Wow.
700 new staff. That doesn't include physicians to support this campus. So just think about with the projects I described to you
Mhm.
for Novant and New Hanover Regional Medical Center, how much that 225 in the master facility plan will bring to the region.
And when I was talking to your colleague, one of the interesting things too is Novant Health has a Pathways to Healthcare program
Yes.
to develop workforce. I mean, how does that work?
Yeah, we have two really strong relationships with Cape Fear Community College
Okay.
and UNCW.
Okay.
So that's sort of an external relationship. So we've committed scholarships to both of those organizations, and
Hmm.
the goal is really to train and then recruit and
Sure.
retain the students that both of those locations. We've had tremendous success since implementation of that program the past 2 years. For Cape Fear Community College, we've had a 70% increase in the number of students we've been able to hire and
Okay.
retain. And then UNCW, one, they've done a phenomenal job of growing the size of their nursing program, right? Just making it bigger. And then the other biggest issue with UNCW previously was a lot of those students weren't from here. They came, they went to school for 4 years, and then they headed
Hmm.
back to New Jersey, like
Hmm.
where I'm from, Raleigh, somewhere,
Sure.
and didn't stay here. And so one of the key things was committing some resources to one, people who want to stay in the area and we want to invest in them, but really also trying to create that stickiness so that they get into the community. So from day one, they're part of a cohort that comes to the hospital. They go to our nursing events. We do
Okay.
education with them. We want them to know the community and feel like they fit in from day one so that they're more likely to stay here. And we've seen 103% increase in the number of students we've been able to retain from UNCW. So to me, it's those, and that's just starting with college. And we also have a healthcare talent pipeline program that starts even younger, all the way down to seventh grade.
Yeah.
Bridges to healthcare, exposing students to all aspects of healthcare. I'm a pharmacist, and I never knew. My family still asks me. I didn't know they had pharmacists in hospitals, right? Everybody thinks of
Yes.
a pharmacist in
Yeah.
CVS, and I think people, we're running little cities, and I think people just
Yes.
don't know the number of jobs that can be within healthcare that touch patients in different ways depending on what your interests are. And that the goal of those programs is really to expose students and children at a young age so they get interested in potential career in
Well,
healthcare.
absolutely. My wife, before she retired, was a unit secretary for a med surge unit
Oh yeah,
at the hospital
they
up
run the unit.
the, and she was busy, you
She
know. It
knew
was
everything about everything that was going on. I mean, they're a lifeline to our nursing units.
she
So
she she loved it. I mean, she started her career on Wall Street, and how she wound up at
wow.
Loudon Hospital is different. Inova Loudon is a long story, but I mean, yeah, I mean, there's a lot of jobs, and there needs to be a pipeline. I want to thank you for your time. I know it's a
No,
very
I
busy.
appreciate you, getting the word out. Leland is an area and just Brunswick County in general that we're fully committed to, and trying to make sure we have access points. Brunswick County also being some of the largest landmass in the
Yes.
state, and making sure we cover it and providing access points is key to our goals for providing healthcare in Brunswick. So we appreciate the opportunity.
I appreciate that. We will be sharing this interview, and also how to submit your comments if you care to the state. And then we will also, once the public hearing is announced, share that information as well. Lori, thank you very much. We appreciate your time.
Thank you, Rob. I appreciate
You're
it.
welcome.
Have a great day.
You too.